How to treat and cure AIDS. There's no cure for HIV/AIDS, but a variety of drugs can be used in combination to control the virus. Each class of anti-HIV drugs blocks the virus in different ways. It's best to combine at least 3 drugs from 2 classes to avoid creating strains of HIV that are immune to single drugs. Everyone with HIV infection, regardless of CD4 count, should be offered antiviral medication. HIV therapy is particularly important for the following situations. You have severe symptoms. You have an opportunistic infection. Your CD4 count is under 350. You're pregnant. You have HIV-related kidney disease. You're being treated for hepatitis B or C. Treatment can be difficult. HIV treatment regimens may involve taking multiple pills at specific times every day for the rest of your life. Side effects can include nausea, vomiting or diarrhea, heart disease, weakened bones or bone loss, breakdown of muscle tissue, rhabdomyolysis, abnormal cholesterol levels, higher blood sugar levels, other diseases and treatment. Some health issues that are a natural part of aging may be more difficult to manage if you have HIV. Some medications that are common for age-related cardiovascular, metabolic and bone conditions, for example, may not interact well with anti-HIV medications. Talk to your doctor about other conditions for which you're taking medication. Treatment response. Your doctor will monitor your viral load and CD4 counts to determine your response to treatment. Viral load should be tested at the start of treatment and then every 3 to 4 months during therapy. CD4 counts should be checked every 3 to 6 months. HIV treatment should reduce your viral load to the point that it's undetectable. That doesn't mean your HIV is gone. It just means that the test isn't sensitive enough to detect it. You can still transmit HIV to others when your viral load is undetectable. Although it's important to receive medical treatment for HIV/AIDS, it's also essential to take an active role in your own care. The following suggestions may help you stay healthy longer. Eat healthy foods. Emphasize fresh fruits and vegetables, whole grains, and lean protein. Healthy foods help keep you strong, give you more energy and support your immune system. Avoid certain foods. Foodborne illnesses can be especially severe in people who are infected with HIV. Avoid unpasteurized dairy products, raw eggs and raw seafood such as oysters, sushi or sashimi. Cook meat until it's well done. Get immunizations. These may prevent infections such as pneumonia and the flu. Make sure the vaccines don't contain live viruses, which can be dangerous for people with weakened immune systems. Take care with companion animals. Some animals may carry parasites that can cause infections in people who are HIV positive. Cat feces can cause toxoplasmosis, reptiles can carry salmonella, and birds can carry the fungus Cryptococcus or histoplasmosis. Wash hands thoroughly after handling pets or emptying the litter box. People who are infected with HIV sometimes try dietary supplements that claim to boost the immune system or counteract side effects of anti-HIV drugs. Supplements that may be helpful. Acetyl L-carnitine. Researchers have used acetyl L-carnitine to treat nerve pain in people with diabetes. It's possible that acetyl L-carnitine might help nerve pain linked to HIV. But it may be helpful only if you're already deficient in acetyl L-carnitine. Whey protein. Preliminary evidence indicates that whey protein, a cheese byproduct, can help some people with HIV gain weight. Whey protein also appears to reduce diarrhea and increase CD4 counts. Supplements that may be dangerous. St. John's wort. Commonly used to combat depression, St. John's wort can reduce the effectiveness of several types of anti-HIV drugs by more than 50%. Garlic supplements. Although garlic may help strengthen the immune system, garlic supplements also interact with several anti-HIV drugs, reducing their effectiveness by 50%. Occasionally eating garlic in food appears to be safe. Be sure to discuss the use of any dietary supplement with your doctor before trying it to ensure that it won't adversely interact with any of your medications. There's no vaccine to prevent HIV infection and no cure for AIDS. But it's possible to protect yourself and others from infection. That means educating yourself about HIV and avoiding any behavior that allows HIV-infected fluids, blood, semen, vaginal secretions and breast milk, into your body. To help prevent the spread of HIV, use a new condom every time you have sex. If you don't know the HIV status of your partner, use a new condom every time you have anal or vaginal sex. Women can use a female condom. Use only water-based lubricants. Oil-based lubricants can weaken condoms and cause them to break. During oral sex, use a non-lubricated, cut-open condom or a dental dam, a piece of medical-grade latex. Consider the drug Truvada. Use of the combination drug emtricitabine tenofovir, Truvada, can reduce the risk of sexually transmitted HIV infection in those who are at high risk. Truvada is also used as an HIV treatment along with other medications. When used to help prevent HIV infection, Truvada is only appropriate if your doctor is certain you don't already have an HIV infection. Your doctor should also test for hepatitis B infection. If you have hepatitis B, your doctor should test your kidney function before prescribing Truvada. Truvada must be taken daily, exactly as prescribed. Truvada should only be used along with other prevention strategies, such as condom use every time you have sex, as it doesn't protect against other sexually transmitted infections, and it can't provide complete protection against HIV transmission. If you're interested in Truvada, talk with your doctor about the potential risks and benefits of the drug. Tell your sexual partners if you have HIV. It's important to tell anyone with whom you've had sex that you're HIV positive. Your partners need to be tested and to receive medical care if they have the virus. They also need to know their HIV status so that they don't infect others. Use a clean needle. If you use a needle to inject drugs, make sure it's sterile and don't share it. Take advantage of needle exchange programs in your community and consider seeking help for your drug use. If you're pregnant, get medical care right away. If you're HIV positive, you may pass the infection to your baby. But if you receive treatment during pregnancy, you can cut your baby's risk significantly. Consider male circumcision. There's evidence that male circumcision can help reduce a man's risk of acquiring HIV.